hypothermia can set in very quick, so people around you might even notice it before you do. You're probably not going to understand you're not feeling well because you're getting too cold, but people around you might notice that you're a little more fatigued. You might not be acting normally. You may be.
When it starts to get this cold, hospitals see a lot of people come in with cold-related ailments, including frostbite and hypothermia. Doctors say both conditions are very dangerous. Mid-Michigan Now's Courtney Bennett joins us. Courtney, you've talked to two medical professionals, so what are they saying?
Will say that they see an uptick in people visiting emergency departments this time of year because of frostbite and hypothermia. Their advice is to make sure you and your family are protected.
We see it in, the vulnerable patient population.
From the elderly to children to those experiencing homelessness, Dr. Michael Safa, a physician at Hurley Medical Center, says when people are spending time outside in the cold, they become at risk.
You can have frostbite within minutes when you have exposed skins.
His advice is to layer up, cover any exposed skin like your head, neck, and hands. However, even if you are wearing gloves, frostbite, it can still set in.
Because what frostbite is essentially your skin freezing and the tissue freezing. And so that certainly can happen even when your hands and feet aren't exposed. And those are probably the areas of the body that are at the highest risk.
They see people come into the emergency room with cases of frostbite, and unfortunately, Dr. Sava says that they end up losing fingers or toes. People are also advised to make sure what they are wearing is dry.
Maybe it's waterproof clothing or boots even.
As a Henry Ford Health emergency room medicine physician, Dr. Sean Mohan says if you believe you have frostbite, he recommends seeking medical care.
And that would include some maybe redness of the skin, some blistering, even some darkened or discoloration of the hands or toes. Please seek medical attention.
There's also hypothermia that doctors see this time of year. According to the Michigan Department of Health and Human Services, it happens when the body temperature drops to 95 degrees or lower.
If you see a family member, a loved one, a friend, a coworker that has some sort of either hypothermia, and that could be just as subtle as some shivering that won't go away, or maybe some kind of confusion.
Both doctors recommend seeking medical care if you have those signs. When it comes to frostbites, there are various stages. According to the Michigan Department of Health and Human Services, they range from skin that might be red and feel cold to skin that turns white or bluish gray. It's recommended people limit their time outside. For now, live in the studio, Courtney Bennett, Mid-Michigan Now.